When I saw my father treating patients and the satisfaction that he used to get in treating patients who were disabled and suddenly making them walk, that gave me an inspiration as well. And that's where my mindset right from childhood was that I want to help people, I want to do something for the country. And that's where I became a doctor and then became an orthopedics and a trauma surgeon. And then wanted to learn more and see what the best things were happening in different centers in the world. So that's where I went out to do my AO fellowship from Canada and then fellowship in knee surgery from the United States of America, and where I got an opportunity to work with the guru of knee surgery in the world. And that was something, a patient, when somebody would come in and basically who could barely walk, making them walk again. A trauma patient coming in who was disabled and making them walk again was a great satisfaction. When I saw all these patients lying on the road, and 95% chances were that nobody's going to help them. So that was the inspiration that I got from the med school when I was there, and we had done the first study that in case of an emergency, there were 95% chances you'd not get an ambulance. We kept working as a social work to do something about it. And we went and tried to revamp the existing organizations, revitalize them. But then when it all didn't work out, so it came to a stage where they said, either you do something about it, which meant that I had to leave my career, a good practice, my own family hospital, and which was actually a very, very difficult decision. My family thought I was crazy, I was mad, that I was thinking of leaving my practice. Where am I going to earn from? The biggest challenge that we faced when we were making rescue was changing minds. The mindset was, it just can't be done in Pakistan, a developing country, a rescue service, and one number and people will immediately get help. So it was like as if I was talking some very strange words, and this was impossible in a developing country. The biggest challenge was we didn't have trained human resource. For the first time, we started the training of emergency medical technicians. Then the ambulances. If we imported them, we couldn't maintain them, the repair and maintenance would have been necessary. So we had to start the fabrication of ambulances within Pakistan so that it was easy for repair and maintenance. Then we started it in October, so 2004. And everybody was, it will not work out. We started with only 14 ambulances in the city of Lahore. A change of government is always a challenge. Whatever initiatives have been taken by the previous government, the new government looks at it from an apprehension and they want to start their own project. Initially, we did face a lot of resistance, and obviously we had to clarify all of those things. So the challenge and rescue go together. And when these people, even from the new government, who went there and said, my mother has been saved because of this, you can stop everything else done by the previous government, but not this service. So I think that became our biggest help, and our performance spoke for itself. Starting from the city of Lahore in 2004, and today, after 16 years, when I see what we've been able to achieve, even it's difficult for me to believe that. Where we started from 14 ambulances and then expanded to all the 36 districts of Punjab province with 110 million population, our fleet went up to 350 ambulances. And we kept it very cost effective, developing a response time based model rather than a population based model. So with minimal resources, we were able to extensively cover the area. When we saw the challenge of the increasing traffic, the congested areas, the walled city or the old city areas where it was very difficult for the ambulance to respond, we went into a motorbike ambulance service. And today, the motorbike ambulance service has transformed everything, and we've been able to respond to over 600,000 calls up till now with an average response time 4 minutes, which I think is comparable even internationally. And everybody, even when we were starting the motorbike ambulance service, was a lot of apprehension. This will not be successful, this is going to be a waste, and nobody could really believe that they could do it. And today, they are able to reach the most difficult areas, the most difficult, narrow streets, even in traffic congestion, they're able to respond to emergencies. They immediately go, they're all trained staff. In 2005, we had an earthquake in Pakistan, and we saw the helplessness of the people. And immediately, 1 year after that, we established our own disaster emergency response team. And then the team, we started building our teams and the capacity of that team. And we finally applied for UN certification in 2015 after we had met the basic requirements. And today, we are the first team, the search and rescue team, which got the UN certification from INSARAG. in South Asia. But then we established a model fire service, a modern fire service from Lahore in 2007, and then this service has gradually expanded to all districts of Punjab. And today this fire service has responded to over 151,000 fire incidents and saved losses worth over 450 billion rupees. So I think that's just by improving the response and professional firefighting. Then came the floods 2010, which was a major event. And so it's like, so that was, we saw the helplessness over there. So we collected all the boards available with different organizations, so organized a service. And today we manage all the floods in the city, every year which come in the province. And today we've rescued over 200,000 victims, from different flood-prone areas or inundated areas. So this was a big change. After the successful launch of an emergency rescue service in Pakistan, I still always wanted to go back and help the people of this country. So my old patients and everybody else motivated me that I needed to give more time to this clinical practice. So I had to sacrifice my evenings for this. So I had to sacrifice my private life, and I dedicate 3 evenings at least in a week to come and help these poor and needy patients. Clinical practice is very important. It keeps you humane, because once you're involved in the entire day in the administrative affairs, managing such a large service, then coming and helping people in need is a lot of satisfaction. And I think if I can provide them with those services, I think that's the biggest satisfaction that I get, which no money can bring. Today I'm very pleased that a mission impossible of saving lives has been accomplished, and millions of people have been rescued without discrimination. But I hope that we can establish safer communities to live, work and travel in Pakistan. That's our vision for the next 10 years.